Good afternoon, everybody, and welcome to Talk with HIROC. My name is Philip D'Souza, and I'm the Director of Communications and Marketing at HIROC. Talk with HIROC is a unique space for us to listen, learn, and hopefully scale knowledge across the healthcare sector, all with the goal of collectively turning the corner on patient safety. Last week, we chatted with Shabazz, HIROC's Director of Insurance Services. If you missed it, after today's talk, just head back to our main LinkedIn page and click the Videos tab on the left. You'll find it there. Finally, we want to make sure everyone in the healthcare is part of these conversations. So please do spread the word with your networks and let others know how to tune in. It's really easy. Okay, let's get on today's show. You're in for a real treat, as we have our Vice President of Healthcare Safety and Mismanagement, Trevor Hall, and he'll be talking about all things human factors. He's joined with Jonas Shultz from Health Quality Council of Alberta and HIROC's Stefano Gelmi. Welcome, Trevor.
Thanks so much, Philip, and welcome all those through the internet as well as LinkedIn. I'm very happy to be here today with Jonas and Stefano, really speaking about safety and having those committed conversations. Very briefly, Jonas, would you mind introducing who you are and your role at Health Quality Council of Alberta?
Yeah, sure. My name is Jonas Shultz. I'm a human factors specialist with the Health Quality Council of Alberta. I've been in that role for, 7 years now, and I'm also an adjunct lecturer in the Department of Anesthesia at the University of Calgary.
Wonderful, and thanks so much for being here. And Stefano, would you mind introducing yourself?
Yes, so I'm the lead safety of the Healthcare Safety and Risk Management Department at HIROC. My background is in engineering, industrial engineering, and human factors.
Very lucky to have you both here, applied human factors experts. As a reflection, maybe we could spend a minute thinking about really what is human factors and how do you see it impacting patient safety?
Sure. Do you want me to go first?
Sure.
Okay, so what is human factors? Human factors is a scientific discipline that takes our knowledge about both mental and physical abilities of humans, and we use that information to design things that people interact with at work generally. And so those things could include the information that they might be using or putting out. It could include the equipment and tools that they might be interacting with, tasks and processes, as well as the environment that they work within. And so that's sort of the what is human factors. In terms of how it impacts patient safety, different human factor specialists, I suppose, would have different scopes or levels of training, I guess. But in my role, the way that I'm involved in patient safety is the first one is in environmental design. So how do we design hospitals or healthcare spaces to accommodate the people who need to work within those environments? And so the framework that we recently, a few years ago, released that describes the process that we use is called a simulation-based mock-up evaluation process, where as part of the hospital design process, we would have healthcare teams enact realistic clinical simulation scenarios within a mock-up. And so what a mock-up is it's a full-scale early prototype of a room that's being designed for a hospital. So for example, in Vancouver, the Vancouver General Hospital, I collaborated with them to evaluate a universal operating room where we had surgeons and anesthesiologists and scrub nurses, the entire team, carry out scenarios. And one of the things we were trying to do was minimize through design the amount of congestion and the amount of unintended bumps that would occur within that environment by having it intuitively laid out and efficiently laid out. And it's a way to test drive that space before the design process. And so we were able to reduce the amount of bumps and congestion in that environment. Another way that human factors is involved in patient safety, in my role anyways, is through adverse event investigations. A couple of years ago at the HQCA, I led an investigation into an event where 186 pediatric and neonatal patients received an incorrectly prepared medication, a high alert medication called parental nutrition. And so through that investigation process, we identified a number of issues and some recommendations. One was to standardize, for example, checking processes, and the double checking process, as well as testing those double checking processes to make sure that they're efficient and effective. So those are a couple of examples. And we're going to hopefully learn a lot more about how human factors is involved in healthcare through a collaboration between a variety of stakeholders, including HIROC and the HQCA and other organizations too, called Patient Safety Talks, where we are encouraging human factors and ergonomic practitioners to submit some examples of work that they're doing and provide short TED-like talks about all of the great work that's going on to improve patient safety in healthcare. So maybe pause there and hand it over to Stefano.
No, thank you, Jonas. And I think you covered the definition of human factors quite well. And it's understanding those users, understanding their environment, and how we can implement technology that works for them rather than the other way around. In my experience, how we impact patient safety, I see it as an indirect impact, but in the end, it does follow through towards the patient. We've worked with manufacturers designing better technology, consulting and helping them understand the limitations on their technology, as well as supporting and frontline staff and clinicians and translating their needs into processes and tools that make sense and are long lasting and sustainable. I can think about the work that we did around the Ebola, and we did a bunch of environmental design simulations for that. And it was quite impactful on understanding what are the limitations with very short time turnaround on testing and thinking of how to design a better technology. So,
Yeah.
Trevor, anything else you would like to add?
No, thank you both. I think that's really interesting, Jonas. I think about how you're designing the conditions in which we work, and Stefano speaking to improving the safety. I think another big piece that I've heard a lot or experienced too is the patient's experience as well, and how human factors not only impact safety but also looks at the user's experience as well as the overall patient experience, which I think is tremendous. Jonas, thank you for highlighting the wonderful work you're leading and doing with the International Ergonomics Association. I think through the patient safety talks also is an additional proposal around a design competition, which really is looking at how can you apply human factors principles to some of these really challenging safety opportunities. And we'll make sure that that information is shared. But I think having such applied expertise here, I'd be remiss if I didn't ask what do you think really makes a successful quality improvement project based on your experiences?
I can jump in, I guess. Yeah, so to be a successful QI project, actually the HQCA has a great resource that sort of describes what is entailed to create a good QI project. And it's sort of a 5-step process, of which isn't specific to human factors, but human factors definitely can and should be embedded within that. And so the idea is for any healthcare system to have continuous monitoring of data, so that at any point in time you can identify for step 2, which is identify what are some of the hazards that might exist within a system. Once we know what those hazards might be, we move on to step 3, which is to prioritize what are some opportunities for improvement, which usually involves some form of a further analysis. And so human factors is great in that hazard identification step, as well as in that deep dive step to prioritize opportunities. Once you have a listing of prioritized opportunities, you start to generate some improvement ideas. So really, you don't want to jump to that step too early, but instead you really want to fully define what are the problems and issues we're trying to address before you come to that improvement step. And that's where you start to develop and test ideas. Again, human factors can play a really good role with testing prototypes or new processes, new tools that might fit. And then once you have those improvement ideas and you decide on which ones you want to do, that's when you go into sort of a system level of change where you're implementing, spreading, and trying to sustain those change ideas. So human factors definitely can fit within that. And so the framework that I'm mentioning is called the Healthcare Quality and Safety Management Framework, which is on the HQCA website. And yeah, lots of opportunities to include human factors in all of those QI projects.
And I agree. And I guess what I was going to answer that was make sure you have a baseline of data. And I think that's one of the things that we get caught quite often is like, oh, I have this project, I want to fix this, but I don't truly understand the problem that I'm trying to fix or have enough data to show change. And I think that's where HF comes into mind on how understanding those user requirements, understanding the limitations of the system, and embedding those expertise. And it's a collaboration between the frontline staff, the people are in the system working throughout, and the HF concepts and skills that we bring. Because as human factors practitioners, we need to learn the system, and we rely a lot on the expertise of the people that are within it. So it's not that we come with the magic wand, but it's about listening and understanding those problems and how we can translate them to solutions that are sustainable, right? And that's and QI. It's about moving forward, making changes in a manageable way that you can see the results, and slowly building sustainability in those solutions. So.
Yeah, well said. So the Jonas's steps around the hazard identifications, the risks, the identification, Stefano understanding where what would define success for you in the baseline. I think the key piece, which I know you both are extremely expert at, is that organic growth, or understanding the conditions in which people work, as well as looking at how systems interact with many different kinds of things. As we're on this LinkedIn live piece and really about sharing experiences and growth, any key secrets or lessons that you may have learned from your experiences applying human factor principles to improve safety? So maybe one or two things that you would want people to take away from today's.
Do you want to go first, Stefano? You might be on mute there.
Demonstrating human factors of the system here. You may still be on mute. So, Jonas, what about you? What do you think?
Sure. Yeah. And so, what would I say is the key secret? One of the ideas, I guess, that I kind of believe in is the Donabedian model, where we have structure, process, outcome. And so the outcome is often what people tend to focus on, which is the outcome of any process. And so obviously it's the process that leads to the outcomes that people achieve, whether it's in their clinical practices, whether it's in the system, whether it's in anything. But in order to affect those processes, those are really influenced by the structures that people work within. And those structures are the things that are sort of in place before people show up to do those processes. And one of the great things about human factors is it really does focus on those structural changes. And the great thing about making structural changes, and when I say structural changes, that could be a change to the environment, it could be a change to the information, it could be a change to the equipment that people use, the forms that they use. All of those are structural elements. And so when we make changes to those things, we find that the changes are sustained for longer periods of time, as opposed to if you tell someone to change the way that they do it, then that will last as long as they remember to do that. But if you change the checklist that informs that, or the environment that they do that to minimize the interruptions and distractions while working, those types of changes will last a lot longer. And so I think one of the key secrets to QI and where human factors really helps to contribute is it does focus on the evaluation of those structural elements in the healthcare processes. And so I would say that's kind of the main key secret, is to focus on those elements so we can see sustained change.
And I was saying while I was on mute was that it's finding that balance between people-focused solutions and system-level solutions. And one of the things I've learned throughout time, because I get really when I find a solution, I really get ownership on that solution. It's keeping an open mind that I'm not going to get it right the first time or the second time or the third time, that there's always something out there to consider, and listening to build those relationships when implementing or building the design of a solution in order to ensure that you are successful in implementation.
And I think that's actually just a great concept in general, which is just really iterative design. And so knowing that we're never going to get it perfect and that there's lots of opportunities, hopefully, to continue to iterate and make small incremental changes over time, you get to a better place, whether it's the best place, maybe not, but it's a better place, hopefully. And another kind of piece that fits in that is lots of those answers lie in the people, which are the end users of the system. And most human factors processes involved some form of testing with end users. And I'm sure there are some like heuristics and things that we can use as well to help with that design process. But really, it gives us a good opportunity to capture the great ideas that are already in the minds of the people working in the systems, and having a way to sort of test those, vet those, and find a way to incorporate them. So, yeah.
I think
that testing, in my experience, when somebody sees a product or design fail, they truly understand. On somebody else's hand, they truly understand, okay, there's something wrong. Sometimes just talking about it is not enough, but actually seeing and mocking and living through that experience does make a difference on understanding of the problem and empathizing with it.
Yeah, no, and I think what I'm taking away from both of you really is that, again, that organic change, but also that investment you're creating by working with the end users. I think that's extremely powerful. There's a lot of reflection within safety literature now about how do you make resilient systems, or ensure things may go as right as many times as possible. And I think really the lessons that you presented really do speak with that. And at the end of the day, taking away from this call or this chat may be the concept of defining what success is. But it really sounds like you're having that committed conversation on safety with those that are using the system. Any other thoughts on what you would want to part with people to take away? I think these are really great lessons on safety and speaks to quality improvement, but kind of a chance to see if there's anything else that you'd like to share.
For me, I guess it's just recognizing that human factors in healthcare is a relatively new discipline. So maybe healthcare started in the 40s, 50s in the world wars, in the military and transportation and nuclear sectors, and started to come into the healthcare in maybe the 80s. But in Alberta, it's really only been implemented in Alberta healthcare systems for the last 13 years. So it's new, and lots of people have different levels of experience with using or applying or knowing where to find information about human factors. And so when I'm thinking about training others about human factors, I try to think about what is the intent. Is the intent to train you to be a practitioner and to apply some human factors methods, in which case it's a much deeper dive into what is human factors and how to use it? Or is the intent to educate people on what is a human factors project, in which case they would say, okay, yeah, this is a great project for a human factors person. Now let's bring in a human factors person to help with that. Or is it just to kind of create an awareness so that you know sort of what human factors is? But it is a new area, and people will have different levels of comfort and knowledge, and that's okay. But it's something that's continuing to grow and to spread over time, which is exciting.
Mm-hmm. No, well said.
This is a fantastic conversation. Thank you for all your insight. A couple things come to mind, though, and this question's for all three of you. If any of you have top of mind an interesting human factors success story that you can share, something that you've worked on recently or in the past that people can, hear some about a success. If anything comes to mind, feel free to share.
Yeah, I can start. I think with maybe not the technical aspects of applying human factor principles, but I think what Jonas was speaking to is having these committed conversations in the presence of safety, or the safety talks that through the International Ergonomics Association, not only design competition on challenges within safety and opportunities within safety, but also the idea of safety talks. So this is what the goal of today was, is to have a committed conversation on safety. There are extremely exciting things around human factors, decision-making, risk, and safety. And I think bringing that forward, as Jonas was mentioning in our presentation, but by furthering these chats, we are having an impact on safety.
No, that's fantastic. You're absolutely right. It does put a spotlight on how important it is. And I guess one thing Jonas said that really, got my attention as well is the fact that, Jonas, you said it's relatively new. So if there's any advice, Jonas or even Trevor or Stefano have any advice for viewers watching this or watching it back, and they're wondering how can my organization, kind of bring it to their organization to implement or to have those conversations. There's just something that people can do today, for example, that will help, build that culture, get the conversation started. Anything come to mind?
I think the things that come to mind would be to identify if you know anyone in your networks of individuals who have human factors expertise, and reaching out to them to share success stories, I suppose, within their organization if they don't have any human factors anything within their organization. I think that's a good kind of starting point, is just to get the conversation rolling about where can it fit and how can human factors help. Those individuals will know the human factors community is very small, and so they will know people who can help out that might be able to be a consultant for a period of time or hired. I think that's kind of what's coming to mind, is just to reach out to human factors practitioners. I often get requests to provide brief presentations to organizations, like a lunch and learn format about what is human factors, what are the types of projects that we do. And that's a great place to start.
No, that's fantastic. And I think that your point about the success, sharing those success stories and starting that conversation and seeing how it can help, those will really get people, kind of rallying around the improvements and just ensuring that the quality is there and that, that together we can make progress. So with that said, thank you so much, Jonas, Trevor, Stefano. We really appreciate you taking time out of your day to connect with our subscribers and the healthcare community, and to spread, just to spread some awareness about how important human factors is in healthcare. We do encourage you to reach out anytime, subscribers. We can always reach out to Trevor or Jonas and Stefano, and we can ask any questions offline how we can help you on your journey as well. So thank you so much for watching, and thank you, Jonas, Trevor, and Stefano.
Thank you.
Thanks for the opportunity. Yeah, it's a great opportunity.